how's the pressure here? And usually they're like, oh my God, that's where it hurts. I want you to take there. Oh, okay. So I'm not gonna do this, and I'm not gonna do this, and kind of open it up. I don't want to jar it up. It's already separating by itself. But I can strip away. I can move in the direction of opening it, lengthening the muscle, not opening the joint is my intention. So these are things I'm planting in my routine. So I start here, I do the compression, how's the pressure, then I warm it up. Circles, chakra, this is where we are, this is what's being used. So it's probably slightly deficient because that's what we're growing from. Do you know what I mean? So it might have some access. This is where I get confused with Chinese medicine, access versus deficiency, things like that. But I just go with intention, and that's all that matters. So I'm kind of building it up to push to spread it out, not to build it up and leave it there. So I kind of do that, and I'd warm up the whole spine, and then it's a test on which erector's more than the other. Is she leaning one way or the other? Is the baby on this side or the other side? Just take that all the way up. Okay, I'm gonna need at least 10 minutes on the shoulders. Do you know what I mean? It's all like an assessment. And then I start, this is my canvas this way, so I start the spreading out that way.
Nice.
And I get my hook in here, and I've already worked this area pretty good, but I just wanna add it into the circulation. I start stripping rhomboids, hitting that mark, looking for trigger points, cross fiber and opening, compression, hold, and then I'm gonna go to giant kneading, side body spreading. I can pin the rib cage down and work the intercostals more that way. Big kneading, big kneading, big kneading. On the side body, then I'm gonna do petrissage with I use these a lot versus fingers or thumbs. So I'll do giant petrissage along the erectors, and it's gonna look like this. And then I can go into stripping. Then I'll get my thumbs out and peel all the lamina grooves of the spine. I can scoop up and down like a train, stretching those intercostals and lamina grooves. Then I can go into my butterfly swim. Open, spread. Open, spread, my swim. Open swim, I call it. And pull back and swim. And it's a gentle rocking, not an aggressive, nauseous rocking. And I get to the whole hip area, so now I'm here. And I'm compressing down because there's a curve from the belly pulling that way. So I'm putting the tailbone back down. That's where my energy is. You can use forearm, rolling, whatever stuff you can sneak in. I'm thinking piriformis is the deep to the two glutes. I'm not gonna get this bottom one over the sheets, or I can expose as much as I can this way, but I'm not gonna do it that way. So I think sacrum attachment, just like the spine. So I might thumb over thumb, not sticking in. My intention is up and away. Okay, so I can do that to the whole muscle. I can forearm it. I can almost stand up and elbow.
Oh, yeah.
As much as I could. And then I know the hip joint's compromised and I don't want to close the pelvis because that's where the baby is. So I can't do any direct pressure there, but I can go around. And there's this whole dip in here in the round ligament and the psoas that leads to the back here. So I'm going to follow the hip curve. It's going to feel so good. She's not going to care what I'm doing. It's not going to be fishy. But I'm going to follow that hip curve, and I'm kind of going to like swim down the slide and like stretch it out, stretch it out, stretch it out. And then I even curve it and cross fiber it this way, scoop it out, scoop it out, scoop it out. Because this is preparing me for my last final stroke, right? So I'm getting that, all of the insides here, because I've done all this. So I'm kind of doing a whole big spin on that whole side. And then kind of just finish. Then I'm going to close. And my final move is the hip rocking one. So, just so you can see your tailbone. This is what you're going to do. No. So her tailbone's here, and that's where my hand is going to be. I just wanted you to see the jeans. So that's going to lock into that hook. And then my hook is going to be back over here where I just massaged and it's not tight. I'm going to kick my fingers out. And this is just the guide. This is the press. My elbow goes into my hip, and I basically just lunge forward with the pressure. And it's going to move her whole pelvic girdle, which seems invasive, but it feels really good. And they're going to say, you could have done that the whole time and I would have been just fine. So this locks into my hip. Well, she's a little too far on the table, so I would have had her scoot back. So I can't really reach my hip too much. So this is where my push is. And this, I just want to make sure it's coming back. And then I reverse it by pushing the joint this way. So I'm going, okay? And it feels really good. I'm a pregnant or not pregnant person, just somebody with a lordosis, period. It's really, really yummy. We'll do that a couple times. As much as it'll go, but that's how you know. Then you can add a straight up. It's not a press down, it's a press out and over. So I'm like tilting her that way, and it's gonna spread. It's gonna be a spongy spring. And I kind of keep my hand here just to feel the spring tightness. So spongy spring, I spring it out and open it a couple that way, and then I go into glute compressions, and then I get the bottom glute as much as I can that I missed, and I kind of just compress the whole leg one more time to the knee and walk myself back, and then just, and then that's one side, and then you turn around and do it again.
Wow.